So I'd say in general, getting a blood transfusion is extremely safe. First of all the blood that we give patients is heavily screened to make sure that we don't have any diseases that are associated with it, and there have been actually extremely few cases of any blood-borne disorders or infections transmitted through blood transfusions.
In 2017, wealthy Silicon Valley executives started paying $8,000 to get transfusions of blood from teenagers. They claimed it made them look younger, sleep better, and think faster. The FDA shut it down, calling it dangerous quackery. But here's the twist. The science behind it is absolutely real. Scientists have been sewing young mice to old mice for decades. The results are mind-blowing. Are we on the verge of a biological fountain of youth? Or playing with forces we don't understand? The dark history. This isn't new. Medieval alchemists believed drinking young blood granted immortality. Nazi doctors experimented with blood exchanges. Even Countess Elizabeth Bathory allegedly bathed in virgin blood to stay young. But in 1864, French physiologist Paul Bert performed the first scientific parabiosis experiment, surgically connecting two living animals so they shared blood. When he connected young rats to old rats, something extraordinary happened. The old rats didn't just live longer, they became physically younger. Modern science has turned this medieval fantasy into laboratory reality. The breakthrough experiments. In 2005, Stanford University scientists revived parabiosis research. They surgically joined young and old mice, creating living Siamese twins sharing one circulatory system. After just a few weeks, the old mice experienced biological time reversal. Their muscles regained strength. Their brains grew new neurons. Their hearts pumped like they were decades younger. Even their liver, kidneys, and bones showed dramatic rejuvenation. But here's the disturbing part. The young mice aged rapidly. They developed arthritis, muscle weakness, and cognitive decline. The old mice were literally stealing youth from their younger partners. A study conducted at UC Berkeley found that blood from older mice was more inhibitory to younger mice than young blood was beneficial to older ones. The molecular mystery. What's actually happening? Scientists have identified the key players. Young blood contains regenerative factors like oxytocin, which rejuvenates skeletal muscle stem cells. It's packed with proteins that promote cellular repair and growth. Old blood contains aging factors like the protein eotaxin, thought to play a role in age-related diseases where systemic inflammation occurs. These aging factors lower our ability to maintain and repair tissue. The relative abundance of aging and regenerative factors shifts as we age. At birth, our blood contains more regenerative factors. But as we get older, that balance tips toward aging factors. It's like your blood becomes poisoned by time itself. Special offer. Speaking of blood optimization, there's fascinating research on red light therapy and its effects on blood flow and cellular regeneration. While we can't offer you young blood transfusions, red light therapy devices, like those from JoeOVV, can help optimize your circulation naturally. Jove offers medical-grade devices that deliver specific wavelengths shown to improve mitochondrial function and blood flow. Check the link in the description for $50 off any device. Their technology might be the safer alternative to these extreme procedures. The human experiments. In 2016, Stanford Medical School dropout Jesse Karmazin started Ambrosia. For $8,000, anyone over 35 could get transfusions of plasma from donors under 25. They called it a clinical trial, but it had no control group, no placebo, and no real oversight. 600 people paid for these treatments. Karmazin claimed the plasma could combat memory loss, Alzheimer's, heart disease, and multiple sclerosis. He described it as plastic surgery from the inside out. Some participants reported increased energy and better sleep. Others experienced nothing. Without proper controls, it was impossible to separate placebo effects from real benefits. The FDA crackdown. In February 2019, the FDA issued a scathing warning. Simply put, we're concerned that some patients are being preyed upon by unscrupulous actors touting treatments of plasma from young donors as cures and remedies. The agency highlighted serious risks: allergic reactions, respiratory complications, transmission of infectious diseases, and circulatory overload. There are reports of bad actors charging thousands of dollars for infusions that are unproven and not guided by evidence. Ambrosia shut down the same day. Karmazin started another company called IV Plasma. Then that closed too. The young blood business went underground. The legitimate research. While companies like Ambrosia sold snake oil, legitimate scientists continued serious research. Tony Whisk-Hooray at Stanford founded Alkahest, which launched proper clinical trials testing young plasma in 18 people with Alzheimer's disease. The results were promising, but modest. Some patients showed slight cognitive improvements, but the effects were temporary and required repeated treatments. Other researchers took a different approach. Instead of transfusing whole plasma, they began identifying specific molecules responsible for the rejuvenation effects. The goal? Create synthetic versions without needing human donors. The dark side revealed. But parabiosis research revealed disturbing truths. In experiments, researchers found that some of the parabiosed died quickly, 11 out of 69 in one experiment, for reasons they couldn't explain, possibly immune rejection. Most deaths were the young mice. The young mice weren't just aging faster, they were dying. Their sacrifice was literally feeding the longevity of their older partners. Harvard researchers extended old mice lives by 6 to 9% through parabiosis. But the young mice experienced dramatic organ aging. It was biological vampirism in the laboratory. This raises profound ethical questions. Would young blood treatments require exploitation of young donors? The surprising alternative. UC Berkeley researchers discovered something remarkable. They found that replacing plasma of old mice with saline and albumin was sufficient to rejuvenate brain, liver, and muscle. It might not be what young blood adds, but what old blood removes. Their research suggests that simply diluting old plasma with saline could provide many benefits of young blood transfusions. This neutral blood exchange could be safer, cheaper, and more ethical than harvesting young plasma. Other studies explore whether removing specific aging factors from old blood might be more effective than adding young blood factors. The future possibilities. The science is advancing rapidly. Researchers are developing artificial blood factors that could replicate young blood benefits without human donors. Gene therapies could restore production of youthful proteins. Alkahest is working with pharmaceutical giant Grifols to create plasma-based drugs for Alzheimer's and other age-related diseases. Clinical trials are expanding beyond cognitive decline to muscle wasting, heart disease, and stroke recovery. The youngest human source of plasma is cord blood, normally discarded during cord blood banking. This could provide an ethical source without exploiting living donors. The scientific reality. Let's be clear about what science actually shows. Studies dating back to the 1950s showed that young rodent blood rejuvenates elderly organs after surgically joining circulatory systems. The main finding: the age of a cell appears to be malleable. All cells can become younger when put in a younger environment. But mouse studies don't automatically translate to humans. Our immune systems are more complex. Our lifespans are longer. The risks may be greater. There is no proven clinical benefit of young donor plasma infusion for aging or memory loss prevention. The risks. Young blood transfusions carry serious risks. Plasma transfusion risks include transmission of infectious disease, allergic reactions, and respiratory complications. Even with screening, there's always residual risk. Plasma infusions can cause serious allergic reactions, including anaphylaxis. Some people experience transfusion-related acute lung injury. For people with heart disease, Plasma infusions can cause circulatory overload, leading to dangerous swelling and breathing difficulties. The blood products you get from somebody, their antibodies and immune components can react against you. The verdict: so is young blood freaky or the future? Both. The underlying science is legitimate and revolutionary. We now know aging isn't just cellular damage, it's influenced by circulating factors in our blood that can be modified. But current commercial applications are premature and dangerous. We don't have enough data on proper dosing, frequency, or monitoring. The FDA's warnings are justified. The future likely lies not in vampiric blood harvesting, but in understanding molecular mechanisms and recreating them synthetically. The ethical implications. This research forces uncomfortable questions. If young blood transfusions prove effective, who gets access? Will this create a biological caste system where the wealthy literally feed off the young? Plasma donation in the US is heavily concentrated among the poor who sell plasma for money. Young blood treatments could exploit this further. But the research also offers hope. If we can identify key factors and produce them artificially, we might extend healthy lifespan for everyone without ethical compromises. Your future decisions. What does this mean for you? Should you sign up for experimental young blood treatments? Absolutely not. The risks currently outweigh any potential benefits. But follow this research closely. Legitimate clinical trials are expanding. Safer alternatives are being developed. The next decade will likely bring breakthrough treatments based on this science. For now, focus on proven longevity strategies: exercise, nutrition, stress management, and optimizing sleep. The science of young blood reveals both promise and peril of anti-aging research. We're unlocking biological mechanisms of youth, but confronting the dark side of our desire to live forever. The future will likely bring treatments that capture young blood benefits without the risks or ethical concerns. But that future requires careful, rigorous science. If this deep dive into cutting-edge longevity science fascinated you, hit that like button. Subscribe for more explorations of the weird, wonderful, and sometimes disturbing world of anti-aging research. Ring the notification bell so you never miss our latest investigations into the science that could reshape human lifespan. Your biological future is being written right now in laboratories around the world. Stay informed, stay skeptical, and stay curious.